I'm Kim, and I'm here to show you the movement patterns of 5 joints in our body and explain to you the planes and axis of these movements, as well as describe tensegrity in my own words. So first, our shoulder joint or our glenohumeral joint, we're going to do lateral raises. This movement is in our frontal plane and our sagittal axis. We're doing an adduction as we come down towards our body, and then we're going to abduct away from our body. Again, abduct and adduct in the frontal plane and the sagittal axis. The second exercise is for the lumbar spine. We're going to do lateral flexion. Again, this is in the frontal plane because we are moving within this plane here. And that is going to be in the sagittal axis as well. So in yoga, a half moon, hands up, and you're going to lean to one side. I do not know all of the yoga words and yoga technique, but this is lateral flexion. Shoulder girdle. We're going to protract and retract our shoulder girdle, and so this is going to be concentrating on your scapula. In a push-up position, you're going to protract, which means you're going to bring your shoulder girdle together, your scapula together, and then retract is to pull away. So this can be done in a push-up position. At the top of your push-up, if you extend even further past a flat back, you are retracting your scapula. And then if you come back down, you're protracting. So in a full push-up, protract, retract. Next exercise is for knee flexion and extension. My weights are kind of long, being the adjustable ones, so I'm going to do this without weight, but you're going to sit and you're going to extend your legs, activating your quadriceps, and then you're going to flex your legs at the knee. So extend and flex. And of course, I forgot in your protract and retract of your shoulder girdle, that is going to be in your transverse plane along your vertical axis or around your vertical axis. And this is your sagittal plane in the frontal axis. For hip rotation, this is back in your transverse plane, vertical axis. You're going to lay on your side, and you're going to lift your top leg. I don't know how much we can see here. There we go. As I get adjusted, you're going to raise your top leg, and as you do so, you're going to point your toes to the ceiling. And then you're going to lower and point your toes down to the ground. I think I need to move just a bit more so you can see the hip rotation. As you raise, point your toes to the ceiling, and lower, you're going to point your toes to the ground. And this is rotating our hip in the transverse plane, vertical axis. So that's it for our movement patterns. Now I'd like to go over my tensegrity model, which I've made out of little dowels. I move closer so we can see. So dowels, electrical tape, and hair elastics is what I had. And a tensegrity basically is saying that our body is all connected. So every joint, every piece of tissue affects the next and the next throughout your body. Demonstrates that if you move one piece of your body, other areas are affected. If you have an injury in one area, this was shown in the video that is online for us to watch, but it pulls and it's going to affect other areas of your body. So that being said, our bones are floating in our body. Our soft tissue is holding them up. And I just pulled my model apart. There we go. If you have an injury, you're not necessarily just treating the injury spot. If you are able to take restrictions away from other areas, you might also loosen the spot of injury. So this is my model, and I guess it could also pertain to overtraining and undertraining. So if you are going to train your chest a lot and forget about your back, you're going to end up with shoulders because you have lengthened muscles on the back and tight muscles in the front. So everything affects the next. And that's tensegrity. Thanks for watching. I hope that you enjoyed my demonstration, and my references will be included on the handout that is attached. Thank you.